More than 3,000 Honduran citizens have joined the migrant caravan in the last hours, while the government of Honduras activated a security operation to repel it. In Peru, the indefinite national strike of the country's health sector continues. Rescue efforts continue in Indonesia after a 6.2 magnitude earthquake took Sulawesi Island just after midnight Friday. From the headquarters of teleSUR English in Havana, Cuba, this is From the South. I'm Gladys Quesada. The migrant caravan gets crowded in Honduras. On Friday morning, more than 3,000 people gathered at the San Pedro Sula bus station to begin their journey to the United States amidst chants against President Juan Orlando Hernández. The forecast numbers of the amount of people have been surpassed. Authorities estimated that the 200 migrants who left on Wednesday night will be joined by another 400 on Thursday for a total of 2,500 on Sunday. On Friday morning, more than 3,000 people prepared to begin their journey to the United States, despite warnings from Guatemala and Mexico, whose governments have already said they will not ease the caravan's movement through its territories. The U.S., in alliance with the governments of Guatemala, El Salvador, and Honduras, signed an agreement that criminalizes thousands of Central American citizens who are victims of violence, hunger, poverty, and exclusion. And the government of Honduras activated a security operation on the occasion of the migrant caravan to the United States. Security forces were deployed on the roads leading to the common border with Guatemala. The uniformed officials verified the identity of the citizens who crossed through the area on their way to the States. The situation passed without any violence. Mexican authorities deployed an operation on the southern border of the country to prevent the imminent arrival of the new migrant caravan from Honduras. Local sources in the southern state of Chiapas reported that the National Institute of Migration placed at least 500 officials on the banks of the Suchiate River on the border with Guatemala. The move aims to prevent the entry of the migrants. The Secretariat of Foreign Affairs issued a statement noting that the Mexican government does not promote nor it will allow the entry of migrant caravans into the country. It said statement urges people to legalize their migratory status and enter the North American country legally. The latest migrant caravan left from San Pedro Sula in Honduras and is planning to cross Guatemala and Mexico with the hope of entering the United States. Human rights and migration will be major issues for the new U.S. government. This Thursday, part of the President-elect Joe Biden's team met with representatives of the Mexican government to specifically address these issues. Authorities and representatives of both parties agreed to address the causes that promote migration. During the meeting, they explained the need and importance of making the economy grow between the Central and North America, which will have an impact on reducing migratory flows. This encounter is a follow-up to the first meeting held between Mexico and the United States on January the 6th. Speaker of the U.S. House of Representatives, Nancy Pelosi, has stated that a COVID relief package put forward by President-elect Joe Biden is delivering on what he said he was elected. Biden unveiled the $1.9 trillion plan Thursday night, which is expected to help prop up the economy and tackle the coronavirus pandemic, providing 100 million vaccine shots in 100 days. Biden called for $1,400 in cash payments for most Americans, the extension of temporary benefits for laid-off workers, and a push to get COVID-19 vaccines to more people. Biden's Democratic allies will have control of the House or Senate, but only by the slimmest of margins in the Senate. That could hinder the chances of the plan's passage.
As the last jobs report of the... But now we have to move on and do it in the right way, and that will require resources, which will require legislation. How it will be done effectively we'll know more about. I have some idea about it because we've made suggestions in that regard. But I think that the message of last night and later today from the Vice President will be a message of hope to encourage people to, again, when it's appropriate for them to receive the vaccine, to do so. But as was said, as will be said, it's not just about the vaccine. It's about testing and distancing and all the rest as we go forward so that we can crush the virus, which is what we must do. Crush the virus so we can open our schools and our businesses, honor our heroes who are on the front line of this, our healthcare workers, our police and fire, first responders, transportation.
In Haiti, various opposition organizations are calling for mobilizations to pressure the departure of the President Jovenel Moïse next February. The mobilizations called by hostile sectors seek to establish a transitory government, create disturbances and destabilize the capital of the country. The spokesperson for the Democratic and Popular sector confirmed that the mobilizations will end in the front of the U.S. Embassy, which they accuse of supporting the president. He also pointed out that during the month of January, new protests are programmed, and from February 1st, the final stage against the current government will begin. For his part, the young head of the state, Moïse, said he will not abandon his post while highlighting the support of international organizations such as the United Nations for his project of constitutional change and the holding of general elections. In Peru, the third day of the indefinite national strike of the health sector advances after not receiving answers to their demands from the government. On the third consecutive day of strike, the health sector federations and unions reported that the union members will mobilize at the National Congress to demand the increase of the sector budgets to 6% of the GDP. The professionals of the state-run system also denounced that the government has not complied with the contractual commitments and work conditions established between the union and the government between 2015 and 2017. Doctors ratified that they will continue working in essential areas such as emergency, hospitalizations, intensive care units, and others due to the pandemic. The president of Bolivia, Luis Arce, inaugurated this Friday the first extended cabinet 2021, with which he will accelerate the impulse of the economy and the fight against the pandemic. The president indicated that the initiative will seek to rescue the lost confidence of the Bolivian people, a consequence of the discouragement and abandonment of the 11th month of the de facto government led by Janine Áñez. The first expanded cabinet will prioritize two central axes, such as the design of a new national budget for economic recovery and actions to begin the immunization of Bolivians against COVID-19. Luis Arce requested his ministers and government representatives to continue dismantling the neoliberal model that was intended to be installed and that hinders the exercise of social rights in the country.
To reactivate the economy, we have the mission to restore people's confidence, to give them back health and education, to restore the works done for 11 years, and during the de facto government, the people have felt helpless without the state protection. Cultural and democratic revolution, all of us who are involved in this process of decolonization, because that is the name of our process of change, decolonization process. All of us who are in the front line have to have a type of behavior. We have to encourage some type of behavior that is worthy of being followed.
In Brazil, the healthcare system of the Amazonian city of Manaus collapsed due to the drastic increase of COVID-19 infections and fatalities, added to the lack of oxygen in city hospitals. Brazil's Health Minister Eduardo Pozuelo said the Amazon state capital is experiencing an oxygen supply crisis for patients with COVID-19. Local media point out that the city presents an unprecedented crisis following the spread of the virus with overcrowded health centers and cemeteries. Authorities were forced to move hundreds of patients to other states in the country and to impose a curfew. Brazil is facing an upsurge of the pandemic, which has left more than 207,000 fatalities, the second highest death toll in the world. Venezuelan foreign minister said on Twitter that following instructions from the Venezuelan president Nicolás Maduro Moros, a conversation was held with the governor of the Brazilian state of Amazonas, expressing the availability of oxygen needed to tackle the health emergency in the northern city of Manaus, where there are several reports of severe oxygen shortages and desperate staff. The city has seen a surge in COVID-19 fatalities and infections. Health professionals, quoted by local media, warned many people could die due to a lack of supplies and assistance. Brazil has recorded more than 205,000 virus-related fatalities, the second highest tally in the world behind the U.S. U.S. federal prosecutors say there is strong evidence that some members of the protrump mob that raided the Capitol last week plan to assassinate lawmakers. The accusation appears in a court filing in Arizona requesting that the judge order one of the alleged rioters, Jacob Chansley, to remain jailed until his trial. Chansley, also known as Jake Angeli and the Quanon Shaman, is the man photographed inside the Capitol shirtless, covered in tattoos and wearing a fur hornet hat. He was arrested last week and is charged with crimes that include actively participating in an insurrection and obstructing a congressional proceeding. The prosecutors said Chansley, aged 33, left a threatening note on the Senate days, where Vice President Mike Pence had sat just moments before. Chansley is scheduled to appear in court on Friday. The United Nations on Friday called for global coordinated efforts to be stepped up in the fight against the coronavirus. UN Secretary General Antonio Guterres issued the plea as the global death toll from COVID-19 topped 2 million this Friday.
Economies have a special responsibility. Yet today, we are seeing a vaccine vacuum. Vaccines are reaching high-income countries quickly, while the world's poorest have none at all. Science is succeeding, but solidarity is failing. Some countries are pursuing side deals, even procuring beyond need. Governments have a responsibility to protect their populations, but vaccine nationalism is self-defeating and will delay a global recovery. COVID-19 cannot be beaten one country at a time.
And the British Prime Minister Boris Johnson said on Friday almost 40% of care home residents had been vaccinated against the coronavirus in the UK. Speaking during a briefing at Downing Street, Johnson said the UK was steadily protecting those most at risk. He also announced that 45% of people over 80 had now received the vaccine. The UK registered their 55,761 positive cases in the last 24 hours, as well as 1,280 fatalities. But despite the high figures, officials said there was evidence to suggest a leveling off in cases. England's Chief Medical Officer, Professor Chris Whitty, said he thought it was very likely that things will improve by the spring, also saying he hoped the vaccine will take more of the heavy lifting rather than restrictions.
Probably to get to a new vaccine if it's needed.
General principle that things are going to improve in the spring. I still think that is very likely. Having the new variant makes that harder. There's no doubt about that. But I think what has happened over the last 3 weeks is we've shown that with everybody working together, we can beat this virus with the current measures, and the vaccine will now help us to do that. And hopefully, increasingly, the vaccine will take the heavy lifting, and less of this will be requiring people to do things. Other areas that went into lockdown a bit later, the peak of the infections will be later, but the peak of hospitalizations is delayed usually by maybe around a week from the peak of infections. That's pushed because it takes a while between people first getting infected to getting ill enough to go to hospital. So that peak will be a bit later in every area of the country, a bit later than the peak of infections. And then the peak of deaths, unfortunately, is a bit later still. So the peak of deaths, I fear, is in the future. The peak of hospitalizations in some parts of the country may be around about now and beginning to come off the very, very top, but at an incredibly high rate, and I cannot stress that enough.
Rescue efforts continue in Indonesia after a 6.2 magnitude earthquake shook Sulawesi Island just after midnight Friday. The quake toppled homes and buildings, triggered landslides, and killed at least 42 people. The Indonesian Disaster Agency said more than 600 people were injured. The agency also reported that at least 300 houses and a health clinic were damaged. Over 15,000 people are being housed in temporary shelters. Power and phones are down in many areas. Authorities are still collecting information about the full scale of casualties and damage in the affected areas. Dutch Prime Minister Mark Rutte and his entire cabinet resigned on Friday to take political responsibility for a scandal involving investigations into child welfare payments that wrongly labeled thousands of parents as fraudsters. In a nationally televised speech, Rutte said he had informed King William Alexander of his decision and pledged that his government will continue work to compensate affected parents as quickly as possible and to battle the coronavirus. The move is seen as largely symbolic, as Rutte's government will remain in office in a caretaker mode until a new coalition is formed after the March 17 election. Many wrongfully accused parents were plunged into debt when tax officials demanded repayment of payments. The government has in the past apologized for the tax office's methods and in March earmarked €500 million to compensate more than 20,000 parents.
We zijn eensgezind.
We are of one mind that if the whole system has failed, we all must take responsibility. And that has led us to the conclusion that I have just offered the King the resignation of the entire cabinet.
Talks between the Indian government and representatives of tens of thousands of protesting farmers remained deadlocked Friday, with the government refusing to scrap new agricultural reform laws, which the farmers say will benefit large corporations. Both sides agreed to resume talks on January 19th. This is the 9th round of discussions over the long-running dispute without reaching any firm conclusions. Protesting farmers have demanded rollback of the laws and said the legislation passed by Parliament in September will lead to the cartelization and commercialization of agriculture, make farmers vulnerable to corporate greed, and devastate their earnings. On Tuesday, India's Supreme Court temporarily put on hold the implementation of agricultural reform laws and ordered the creation of an independent committee of experts to negotiate with farmers who have been protesting against the legislation.
In today's meeting, we discussed the same issues, repealing the black laws, but the government is just not relenting. We repeated that they should repeal the laws, but the government is stuck on it. Next meeting is on the 19th of January, and in that meeting, we will ensure that they repeal the laws. We will win and go. There is another meeting again on the 19th. We have told them that there will be talks on two issues only. One, the government should take back the 3 laws and make a law guaranteeing MSP. The talks will be on these 2 issues. If they accept, it's fine. Otherwise, we will not go for another round of talks.
The Chinese Ministry of Foreign Affairs spokesperson Zhao Lijian said Friday members of an expert team of World Health Organization began a mandatory quarantine in Wuhan before carrying out joint research at the origin of COVID-19.
After consultation between the two sides, the Chinese government had agreed that the WHO would send experts to China on January 14th to exchange ideas with Chinese counterparts on science-based cooperation in novel coronavirus origin tracing. 13 members of the WHO expert team arrived in Wuhan at noon yesterday and were arranged to stay in a quarantine hotel. China's remote coronavirus test requirement is based on the current international epidemic situation and refers to the practices of many countries. The purpose is to ensure the personal exchanges in an orderly manner between China and foreign countries by adopting epidemic control and prevention measures as the premise. This is not only to safeguard the hard-won achievements in the epidemic prevention and control efforts in China, but also to minimize the risk of cross-infection on their way to China for the sake of the health and safety of all people.
Iran's Islamic Revolution Wardenship Aerospace Force launched maneuvers in Persia's central desert on Friday to test a new generation of weapon systems. This is the first phase of the so-called Great Prophet operation. Using a new generation of missiles and drones, the Iranian forces have carried out combined attacks against the hypothetical enemy base and destroying all the designated targets. After drone attacks against alleged enemy missile shield, the new generation of Zulfikar, Selsal and Desful-class missiles have dealt heavy blows to their targets in the exercise. The Iranian armed forces disarming massive projectiles on the ground along with unnamed aircraft operations. And we have come to the end of this news brief. But remember, you can find this and many other stories on our website at telesurenglish.net. And also, if you feel so inclined, join us on social media, Facebook, Twitter, Instagram, and Telegram. For Telesur English, I'm Gladys Quesada. Thank you for watching.